Hi, my name is Oreste Iocca and I'm an oral surgeon based in Milano, Italy. Today we're going to answer some questions related to the cancer of the oral cavity. Cancer of the oral cavity is not uncommon. Last year, around 350,000 people were affected by oral or lip cancer in the world. For example, in Spain, between 4 and 5,000 people receive this diagnosis each year. In Western countries, tobacco and alcohol consumption are the most important risk factors for the development of oral cancer. In the last 30 years, the role of human papillomavirus has emerged as a potential risk factor for the development of this type of cancer. On average, the age of diagnosis is 62 years. The majority of diagnosed patients are males with a history of regular alcohol consumption and smoking habits. Unfortunately, many cases of oral cancer are diagnosed at an advanced stage. For this reason, family dentists must perform a complete mouth evaluation at least once a year. The occurrence of white or red patches in the oral cavity, or symptoms like unexplained bleeding, pain, or numbness in the mouth, requires immediate evaluation by an oral surgeon. White or red patches always require a specialist consult, given that they can be an early manifestation of oral cancer. Only the mouth examination by a specialist, sometimes followed by a biopsy, will allow us to make a final diagnosis. Management of oral cancer requires surgery in the majority of cases. The extent of surgery depends upon the stage, which is correlated by the dimension of the tumor, the involvement of the lymph nodes of the neck, and the presence of metastasis. In curable cases, radiotherapy is usually performed in association with surgery, so to maximize the efficacy of the cure. The role of chemotherapy in the management of oral cavity cancer is evaluated on a case-by-case basis. On the other hand, oral cancer in very early stages may require just a minimal invasive surgery. Radiotherapy is a treatment modality that uses radiation to kill cancer cells. On the other hand, chemotherapy is a drug treatment in which different medications can be used. A multidisciplinary team composed of oncologists, head and neck surgeons, radiotherapists, and radiologists will decide which is the best treatment option for every single patient. Side effects of oral cancer treatment depend upon the extent of surgery and the need for radiotherapy or chemotherapy. Common side effects include dry mouth, taste change, difficulty swallowing, difficulty opening the mouth, among the others. The duration of each side effect is variable. Some of them resolve in a few weeks, others can also last for the entire life. Cancer treatment is always multidisciplinary. The role of the dentist is extremely important before, during, and after the treatment. For example, gum disease or caries should be treated before major surgery. This reduces the risk of infections or complications. After cancer treatment, the maintenance of optimal oral health could help in reducing common symptoms such as soreness and dry mouth. The dentist can best advise the patient on how to achieve optimal oral and dental care. Follow-up care is also extremely important in the follow-up of the patient in order to detect potential complications of treatment or cancer recurrence. Unfortunately, recurrence is possible, and for this reason, long-term follow-up is the standard of care for patients affected by oral cavity cancer. The most important preventive measures are related to reducing alcohol consumption and stopping smoking habits. A complete mouth check once a year is also important in preventing this kind of disease.